This is Doug Brunk reporting from the annual meeting of the American Urological Association in San Diego. A new study predicts that the number of urologists will decrease almost 30% by the year 2025.
Healthcare delivery in America is changing dramatically. The Affordable Health Care Act is just one very significant example of how things are going to change and how there's a lot of debate on what those impacts are going to be. But one thing that seems to be fairly consistent that most people can agree upon is that there's going to be an increased demand for healthcare services and medical services with more people covered. So one of our goals was, how prepared are we in the field of urology to address these increasing demand for our services? On top of the changing healthcare environment, the baby boomers have hit the age of 65 and represent the most fastest growing segment of our population. And with that, we know that urology services are often for older individuals. So again, the demand, there's this significant potential increase in demand, and are we prepared in our size and our numbers and our distribution of urologists to address this demand? What we found is we didn't really address demand in our study. Last comment about demand is the Department of Health and Human Services estimates by 2020 that we will need 16,000 urologists in the United States, the fastest growing segment of any medical or surgical subspecialty. We're almost in a critical potential future shortage. There's a lot of need for primary care physicians going forward, but we can't forget there's some subspecialty areas that go hand in hand with that. With the need of 16,000, we demonstrated in our projection model, we're currently at about 9,000 urologists, and by 2020 we'll likely be under 8,000, probably 7,500 urologists. For a variety of reasons. One, probably the most important reason, is the aging of our workforce. Right now, 45% of urologists are over the age of 55, and almost 8% are over the age of 70. These are practicing urologists, so they're going to, in the short and medium term, going to retire out. We also looked at the impact not just in numbers, but in distribution. And in the rural areas really are potentially going to be the hardest hit. Right now, about 11 to 12% of urologists practice in rural areas, whereas 18 to 20% of the population. And the recent trend over the last 10 years has been for urologists, new urologists, to go to urban areas to large amounts. So that's really going to make that discrepancy even more significant. The assumption is that this may have an impact on the care for patients, the quality of care, and even some very specific outcomes. In fact, that's actually been shown in some studies that the density of urologists, number of urologists, can actually impact mortality rate, death rates from kidney cancer, bladder cancer, and prostate cancer. Counties with no urologist in them, for example, and that represents currently 58% of the counties in the United States, have significantly higher cancer mortality rates for those cancers. If you add just one urologist to those counties, you then flatten out that negative effect. So supply is going to have an impact, again, not just on access of care and time to being seen and so forth, but I think there's a real worry that it can actually affect health outcomes, including mortality.